Welcome to Tea with the Experts and Dr. Leah Merle, your premier destination for mental health insights, empowerment, and inspiration. Led by the passionate therapist and counselor educator, Dr. Leah Merle, this interview-style podcast delves deep into diverse themes with top-notch experts in the field. Beginning with the What Is series, from anxiety, trauma to resilience and mindfulness. We sip our way through captivating conversations, psychological insights, shedding light on the complexities of mental wellness and what it means to be a human being. Each episode serves up a refreshing blend of knowledge, empathy, and empowerment, aiming to destigmatize mental health issues and raise awareness in an engaging and approaching manner. So grab your favorite cuppa and get ready to step yourself into transformative conversations that will leave you feeling uplifted and enlightened. Subscribe now and join the movement to break down barriers and foster a more compassionate world.
Hello and welcome back to Tea with the Experts. I'm your host, Dr. Leah Merle, and today I'm absolutely delighted to be joined by one of my mentors, the incredible Bobbi Kidder. Bobbi is a drama therapist and an educator with a wealth of experience using a creative approach to help people explore their emotions, heal, and grow. She is a registered drama therapist, and Bobbi combines her love of the arts with a deep understanding of psychology, really to create a unique therapeutic experience for her clients. So today we're going to dive into the fascinating world of drama therapy. We'll talk about how drama therapy can be a really powerful tool for self-discovery and emotional healing, what a typical drama therapeutic session looks like, how this therapeutic approach can benefit people from all walks of life. So Bobbi, it is such an honor to have you here. Thank you so much for joining us today. Bobbi Kidder.
Hi, Leah. Dr. Merle.
Oh, yes. Cheers. We've got our cups of tea as we sip through this fantastic episode. So this is a real privilege for me to interview you, Bobbi. So thank you so much for being here.
Pleasure.
You've been here right from the beginning. I met you at the very beginning of my therapeutic career.
I know. Can I just say something about that?
Of course.
Well, we had a small cohort, and it was a really precious cohort. And I had the good sense to say, oh, enjoy this. This is not always going to be any part of what it is. There will be different things, bigger size, more people, whatever. And I did. And I'm so glad that I did. You know what I mean? Sometimes things pass you by and you think, I wish I'd given that more thought. But I knew what I had, and I knew what a precious experience it was for me to get started there at Antioch. So,
yeah. Oh my gosh. It was we could go on. I could go on about my experience, about how amazing it was, but it was so, so special. I just feel very grateful at that point in my life for arriving with such a cohort. I think that you're right, it was really special, the drama therapy cohort specifically. And then also, as I went on to the PhD program, I have my PhD cohort as well. So it's a special place in my memory, let's put it that way.
right. I think drama therapy has, as the creative arts therapies, have that special energy around a cohort that allows people to be colleagues after their graduation, that you move on. I've seen that happen many times, and it's to great purpose because they know each other. They've been working together. And
yeah, there's a level of trust and connection that is built through that experience that I can't describe it in words. It's just really, really beautiful. So, yeah. Well, let's get started in the essence of time. So let's start by you explaining to our lovely listeners a little bit about your journey. So what led you to drama therapy, and why did this approach really resonate so deeply with you?
I used to start at a different point of my journey to talk about it, but really I found the population first.
Yeah.
I was hired as a resource room teacher at a school that was on the grounds of a refugee. They called it a refuge for neglected and delinquent teenagers.
Yeah.
And I worked with the younger population, but when I worked with teenagers, it was all girls. They made it all girls.
Yeah.
And a lot of them had been in really violent situations. This was a residential place, and it was run by the Daughters of Charity.
Yeah.
And it was, just as a note on that, one of the things about it is that the Daughters of Charity were a darling charity for the celebrities of Los Angeles.
Wow.
And so the beautiful grounds and the beautiful things that could happen and the beautiful, holiday celebrations and stuff were thanks to many, many people you've heard of that were in movies and so forth that would come and dazzle for a moment, the holiday season. So, that's where I was working, and the LA schools put just a plain old concrete building on the grounds of that fine rolling hills. And so when I had the opportunity to go to a workshop after I had been working at this location, and then I started using drama right away, because it felt so good. And so they sent me to this workshop called the I Can Do That workshop, which was about arts in neurodivergence and physical disabilities and so forth. And I was in a class with the drama. We did drama and music and visual arts and movement. So at the end of it, she said, well, you've obviously done some work in theater before. And have you ever thought of drama therapy? Because you're off, and I said, I don't know what you're talking about. I was definitely, so she said, well, call Roger Altenberg. Roger Altenberg, you can find his name in the history of drama therapy. And he was at Cal State LA. And so when I met him, then it was really a case of what Maya Angelou had said was, it doesn't matter what you do what it matters is how you make people feel. Mm. And so he answered his own phone. No. This is like you're in Los Angeles and you're kind of a small town person. And I was like, oh my gosh, he said, I'd love to take you to coffee and just talk with you about this. And I was really impressed with his level of commitment to something that I really was experiencing. And so my classroom, so to speak, got the permission to be a bit of a pilot for some people to come and do practicum things and so forth. And it just came naturally. And I had a situation that in my life had been a burden, and I worked it out in a psychodrama class. And I thought, I want to do this for other people. And this is the kicker, though. I was talking to Roger, and he said, yeah, that book is in my list, my bedside list of books. And I said, the one by Augusto Boal? And he said, yeah. And I said, well, that's kind of a workbook, isn't it? I mean, he said, by your bedside. And he goes, I don't know what you mean. And I said, so this is beloved in your life, and there's no separation. And he said, well, I take breaks, I have what we now call self-care, but I really have found that I'm curious to see where this can go. And I just love it that we're bringing in other practitioners like Augusto Boal and Jonathan Fox.
Yeah.
And so that was a long-winded story of how I got started. But the journey was really with these young women who were refugees from gangs and a lot of domestic violence, a lot of things that really gave me, a lab. And I loved it. I loved working there. And
yeah, it's amazing. Thank you for sharing the story, because I think it, for a lot of us in the drama therapeutic field, I think that it starts like that, right? Everybody has their story about how it starts. And not everybody, even now, even though drama therapy is much more, people know about it more, I think that still a lot of people are unfamiliar. So that's my next question, actually. For those that are unfamiliar, can you explain what drama therapy is and how it differs from like a traditional psychotherapy, talk therapy?
Sure. Drama therapy is an active experiential approach to facilitating change.
Yeah.
And you can do it through storytelling, through projective play. I have like masks and puppets, all kinds of puppets. I just brought a couple but you can do different size puppets. And sometimes people, there he goes. Sometimes people play with them, and sometimes they just hold them for comfort. I have some very plush puppets. So projective play, purposeful improvisation, I call it therapeutic improv. That's really one of my specialties, is that, and performance. And participants do the same thing, but they rehearse their behaviors. So it's embodied.
Yeah.
And I think that's the big, if I would pick one word that would really describe it for me as different from anything else, it's that it's embodied.
Yeah. That.
I use the phrase, let's put it on its feet. And if somebody's in a chair, I say something different. I say, let's move along with this one, or something like that. But it's always about that kind of energy. Yeah. And it's about practice being in a relationship. We have all kinds of forms that really address empathy and conflict resolution. I like to say conflict transformation is in transcendence is the goal of those kind of practices. But you can manage, you can do all kinds of things with conflict, and you can find flexibility between your life roles through these embodied practices. You can look in role theory, we find that. And then we've always borrowed from Gandhi to say, be the change you want to see in the world. So there's a lot of justice, social justice embedded in it. And that's part of what I'm dedicating these years of my life to as well. So I have a project we'll talk about later.
I'd love to hear about that. And you've already mentioned some of the core kind of techniques, right? And methods that we use in drama therapy. Tell me about that. The techniques that you use. You talked about improvisation, you talked about psychodrama, and how is that built into somebody's therapeutic treatment plan? Let's start there.
Right. And one of the things that I think when I've come into settings, I've talked about drama therapy as an adjunct to whatever is going on, and so it worked really well when I was working with someone who was a narrative therapist. That was really, really nice. But the narrative therapy, was intact as well. And this was something that could come into it. So there's always that particular option with drama therapy. One of the things I want to say is that we have a book called Approaches to Current Approaches to Drama Therapy. And it's thick. I mean, there are all kinds of ways that people approach drama therapy. Yeah. And some of my heroes are just doing incredible things internationally and in terms of changing people's way of speaking about what we've always called disease or disability.
Yeah.
And so it's great. My close book is Acting for Real. Renee Amuna wrote this book, and it's an integrated 5-phase model.
Yes.
And it's the one that, it's like, there's a little bit about it when I looked at it, and so I thought, what is it that someone would find to disagree with here? This is like, you start with something that people can engage with, and then you go deeper, and then you celebrate, and you see where it's going to go when they leave. It's a thing, and you don't say, well, this week we're going to do the first part, and next week that's when you start to look at other benefits of drama therapy. And I think other therapies have this as well. But, you think, okay, we're going to dive next week into your story. We're going to do it. And the next week they come back, and what they want to do is just play. They just want to do some of those things they did at the beginning that made them so happy. And so let's do a bit of that. Let's go ahead and do that and see if we can edge into different themes.
I love that. Can you talk about improvisation and how important that is within the drama therapy world?
I wanna say that the last time I taught improv as a class at Antioch University, I had it was just a dream. There have been other experiences. I've had really good students all along, but this was a dream of really piercing the model and bringing therapeutic drama into it. So we were doing this activity that's called String of Pearls, and each person brings in an element of the story. You can you start with the name of the story. So the night was wild, and then the first person has the first line, and then you have the last line, and you build different lines in between. So I said, we had a story that was like, the darkness fell between them. That was the name of the story, the darkness between them. And so where it went, it was just this amazing thing that it was like very, very deep and heavy, and it came to the end. And then toward the last line, somebody came in and said, and then I thought, what if I looked at this a little differently this time? And I didn't do what was done before to me. That was her line. And everybody went, this is where we've come to a place where people will scaffold. You'll start with just improv for play, and then you'll come to a place where you'll want to do something deeper. Yeah. And this was it. And so I mean, I've done this. I've directed a drug court theater, and that's how they would work. They would always go deeply into some of their issues and so forth. And we played that game and so forth. But to think about, you're in a group and you direct them to just keep playing, but it comes to this. And I've done it since then, but I credit that group for that moment of saying just any game can have a little bit more heft that can help bring insight and can help bring confidence.
Yeah.
It was so beautiful to see the people who were really scared to take the class and then just, they just found it. And that's the way that you approach improv. If it's a therapeutic approach, you don't start with gags. And I mean, I love improv, but when you're doing something for a therapeutic purpose, there's a kinder energy about it. That's all I can say.
Yeah. That's so the kind of energy. I like that. Yeah.
And there are things that also, as we're doing improv, I like to include playback theater with it because it's an improvisational form, and I'm a member of a troupe, and we do performances, and I find it to be one of the very best things that exists in the world, really, for telling stories and for having those stories witnessed. So we include that as a part of the class, and so that's how I've created the therapeutic improvisation for now, and I just looking for the possibilities as I go forward because I think it's really exciting.
I think so too. I mean, the change and the growth that can happen when embodied is the term that you use, which I love. It's when somebody bypasses the verbal, right? We don't have to talk about the issue. We can play through the issue. And I remember that book that you had us read, Stuart Brown's play, in improv, because we do forget how to play as we grow up. I hear this all the time, like in therapeutic sessions, like, well, play is for kids. It's uncomfortable. Well, yeah, it's uncomfortable because we've forgotten how to do it. But what about leaning into the flexibility of that versus the rigidity of being an adult with adult issues? Play is really important as a part of self-care, right?
The other day somebody said to me, "Do you laugh every day?" Like that would have been an anomaly. And I said, "What do you mean? I mean, how do you get through a day?" I'm laughing now. I mean, how do you not laugh? And she said, "No, I don't laugh every day. I don't." And so I was telling that story to friends who I think are pretty jolly. And they said, "Yeah, to have a good belly laugh, I don't do it every day."
Yeah. Wow.
And I think that that's a misfortune. I think that that's better for your health when you learn to do that.
Yeah. Agreed. Absolutely agreed. What about thinking about drama therapy helping individuals explore those difficult emotions and maybe experiences that might be challenging through verbal expression alone? Because drama therapy takes it that level deeper through a more somatic kind of body-based.
Right. Somatic is exactly, yeah. We did a workshop putting the somatic, professor of the somatic program at Antioch with drama therapy. And we really found it to be a useful, conscious thing to do, is to look at the body keeping the score and where those things are. And I love the art therapy thing that I learned from an art therapy student, which was to do a kind of a lifestyle puppet or life-sized puppet and had them color the area where they were feeling a tightness or something on the puppet. And that brings, just as a tangent here, it brings one of the things that is also really lovely about drama therapy is the aesthetic distance that's possible as you scaffold somebody's comfort with that, as you're talking about those metabolizing all the emotions we have to, do in our lives. So I think the important thing to do is to be curious and to listen. I really think to say, well, this is how we handle that when you have this difficult emotion, we'll do it this way. But more to just take your time more. When I do workshops now and I give people some time off, I don't call it a break anymore. I call it a rest, because I think that we do not laugh, we do not rest very much in our lives. And I think I'm learning how. I'm not very good at it. So I'm not.
I think you're really beautifully talking about this somatic experience of the modality itself and how it's helpful to explore emotions and experiences of somebody's past lived experience that bypasses the verbal, right? It doesn't have to be necessarily talk therapy. I do talk therapy with clients all of the time, but there are other modalities that are more somatic oriented and more focused on the body, right?
No, that is so true. And you also used a term which is not, it was not in the lexicon and now is, and I love it, which is your lived experience. So you really start in a narrative way. You start to reshape somebody's way of phrasing their awful past, and you say, in your lived experience, and how it's settling in your body. And there's so many ways within that somatic therapy that are really impressively useful.
Mm-hmm. Agreed. And you talked about aesthetic distancing too, and aesthetic distance within the drama therapeutic work. I remember when I was intimidated by that work. It's like, oh my gosh, Bobbi's talking about aesthetic distance. What does that mean? But when you really see it happen, when it's in a performance, when somebody's kind of like working through their own lived experiences we talk about, and then they start to kind of, I always explain it as you move from the inside of the circle to the outside. So you're able to look in on the issue maybe that you used to have or used to struggle with, or the traumatic experience that you've been through. And now there's more space, there's more levity, there's more distance from it, right? It doesn't feel as hot or as challenging. Maybe it's, that's all the ways that I explain.
I love what you're saying. I think that's a really good way of expressing what aesthetic distance does. And we do that with those projective techniques. We do that with puppets. We do that with masks. We do it, but we also do it with story. And so I love, just like, it's impossible for me not to ask people this when the weather is bad. So how would you use this as a metaphor for a relationship or a state of being? How would you look at blustery or, whatever, that we can find those words, and we can people create fairy tales, or they create stories where there's clearly somebody who's a character like the person telling the story, but it's far enough away that they don't have to take ownership for it, and they can look at their creativity instead,
Creativity, oh my gosh, it is everything without a doubt. And you were talking about the narrative side, like storytelling. So what's your opinion in your experience of teaching and being a drama therapist? In what ways can storytelling and these other dramatic techniques that you're talking about aid really building empathy in both for your own experience, but also for others? What are your thoughts there?
One of the things that I wanted to say, to be sure and say, is that one of the approaches that I have taken recently is to look at a piece of literature. And so the first one was Raymond Carver's Late Fragment. And it's a very short little piece. It's, and he was in fact very close to his own death from pancreatic cancer. So a question that was pointed in this way: did you get from what you wanted from this life? Even so, I did. And what did you want? To feel myself beloved, to be beloved on the earth. So that's what I've done this a few times now with a group. And what we first focus on is even so. And I'm doing this to say something about aesthetic distance too. So even so, can you say something about even so? Because we have these things in our life that we say, well, yeah, but even so. And then we have, let's look at it more deeply, that even so, I did get what I wanted from this life. So how is that possible? And then, of course, the last question, the monologue, is about beloved, to be beloved. Mm. And so that particular workshop curriculum, it's a performance piece that we do, and there are a couple of them on YouTube that I find it to be a really great exploration. People find a lot of depth in it, and so I found other pieces that I've used. So that's one of the ways that story can get in. I think that what I have started to become, I got introduced by someone in your cohort to Paul Harris, who is a therapist, and he has a book called The Confidence Gap. And he talks about, the confidence that we lack that keeps us from feeling that we can have any options, that keeps us away from an abundant view of life and keeps us in scarcity. And so I've started thinking about those kinds of things, those expanded narratives, as starting with an idea of let's do some confidence building things and to help people find their story. And you'd be surprised at the number of people who say, well, there's nothing, I don't have a story. There's nothing really very interesting about me, obviously. And you're just like, oh, precious child, no, that's not true. And so sometimes I even head that one off at the pass. If anybody came in here thinking that they don't have a story, forget about it. No. Everybody's got a story. Everybody's got a story. And a story that is tugging at your leg saying, I've got to be told. Because when you can unburden that, when you can externalize the internal through story, you have unburdened something that is so glad to be let go of.
Yeah, so story is super, super important. What about thinking about it from a mental health perspective? Are there any mental health challenges or issues, maybe such as trauma that we deal with constantly or anxiety, that you really think drama therapy is especially effective in addressing?
I do. I think that in the book that Nisha Sajjani really led the way on about trauma in drama therapy, she talks about something that I think is a really special treat about drama therapy, and that is that it embodies humor so well.
Oh, yeah.
Because that play piece of it is about that. And so they had experienced, I can't remember the nature of the group, but this story is very vivid. It was children, and they were really scared. And they came into this room, and they're all together. And pretty soon, somebody who came to join the group that was in session with another therapist, all they heard down the hallway was the sound of laughter.
Yeah.
And I get teary thinking about that. And the number of times when I've heard that, I heard it from somebody who was in Greece. It was during the time of all the European bombings and wars, and these were refugee families, and they were in a place in Greece, and they wanted to do some deep work on the trauma that they had gone through. And so they had this group, and there were a lot of kids who came to it, and they started doing it. The people left crying, and hardly anybody came back. And then they decided, well, what's missing from childhood when you've been through trauma like that? That's childhood.
Yeah.
So this was just a letter that one of the people who was there wrote to me and said, so we started with a few people there, and you could hear the sound of their laughter. And so then we got the group gathered, and we stayed in what was essentially phase one for a long, long time. In that kind of situation where you're fresh out of the trauma, we had that situation happen here in our valley when two of the little small towns actually burned down one year. And so there was this area where people were coming and therapists were coming as practitioners.
Yeah.
And I thought, these folks don't even want improv, and that it's too much. So I think that when you look at trauma, you look at that very, very intentional scaffolding. I remember a story when I was working, we took a group of students to India, to Dharamsala, India, and the Tibetans in exile who live there. There was a story that this young man had told me, just the two of us chatting over coffee, about he'd never known his parents because as they were crossing over the Himalayas, his parents gave him to someone else, and then they were killed. And so when we were all together as a group, and there was a lot of trust in the group. There were some wonderful students who who were in that trip. And so we were telling the story, and one of the girls who played his mother laughed nervously, and he just said, I can't do this. I can't do this. It was like, I can't. And so the permission to stop and to have everybody say, let's honor what he's shared with us. This is a story that tells us about courage, and it tells us about sacrifice, and it tells us about challenges that are almost too brutal to speak of. And he's shared that with us, and thank you. And he said, yeah, I'm so sorry. And everybody was, when you feel that as a group, that trust is what helps you carry. And she goes, I'm sorry, I didn't mean to laugh. I was just nervous because she had dropped this baby, not knowing that the person had handed her a baby. In the pantomime, And so she laughed, and he was just, so things will set people off and it's just to know that you, instead of saying, don't take it personally, you do it, not that you'd say that in any group, but you want to be very, very, well, I do. I've worked with people who have histories where I'm just very, very careful how we go and approach it. But then I like to do things like empty chairs.
Yeah.
And have people talk in that.
Love the empty chair technique.
To start with, I think that Gestalt is I think it's a wonderful tool to both, you're not talking to anybody, and yet you're talking, people really do imagine it,
That's right.
Talking to people with that.
Yeah. It's a level of mindfulness, I think, as well. Like, you're talking about mindfulness practice that comes into it because it's a blend. And then also this level of creativity that you're encouraging people to get into. So drama therapy often involves tapping into a person's creativity. So how do you see creative expression influencing maybe personal growth and also healing in your clients?
Well, it's something, if I were going to make a list of things that I think drama therapy, that I'm guided to do in my work, that it is that kindling that belief in your creative nature. I think that, like, people have a thing about play as adults, they also say, well, I'm not really a creative person, Yeah. I cook 3 meals a day, but I'm not really creative. I mean, that kind of thing. All the things that I do don't really qualify as creative. And so to find a way to connect the story to all the things that you do so that you have that infused in your life, I think overestimate how powerful that is. When somebody says, this is exactly what I've needed, and they have that way of looking at it. This is just what I've been looking for, and I didn't even know it. And it set something free in me. All of the ways that people describe what happens when they're in a really a trusting group or a trusting relationship with their therapist who's putting these active strategies in play.
Yeah, beautifully said. And it's so empowering. That's kind of the thing that I think about, like empowerment comes to mind, and how drama therapy empowers individuals really to just kind of reconnect with parts of themselves that might feel hidden, repressed through their experience.
Absolutely. That's absolutely true. A person was saying it the other day to me, this is another kind of a fine point I wanted to make about all of this, is she said, I just want to help, I want to protect people who have no voice. And I thought, I would never say that about anybody. I would say that sometimes we've suppressed our voice. Our voice has been suppressed, or you suppressed it. We have unexpressed thoughts and emotions, and connecting with that is going to be a powerful element to making your voice heard. But I think it's a mistake to say that these women with no voice. I think no. That is, I think it's a bit arrogant, actually, to think you would ever assess anybody in that way. At least it feels like that for me.
Yeah, no, absolutely. I really appreciate that honesty and that perspective. I'm thinking also about the fact that really drama therapy is a trauma-informed approach, right? Rather than kind of minimizing somebody's experience, you're talking about empowering them and just kind of focusing on, okay, well, they have an experience that they bring with them. They're not broken, right? It's not what's wrong with you, it's what's happened to you, right? I love that term. But how do you create a safe enough, I never say safe, but safe enough space for clients to engage in the drama therapy process? Really, when you're especially working with trauma survivors, because that's a certain population that can be easily activated in that process. So what do you think there as a trauma-informed approach? How do we build that safe space as a drama therapist?
Well, it's really important to establish trust. And there are ways, each person that I would meet, I would have a different way of being curious and listening, and that. I'm remembering the story. I worked in a women's correctional facility I came in and was an artist in residence there. And so I came in and this woman said, I hear you're into drama therapy. I hear drama therapy. Well, we got enough drama here to fill a bucket, and nobody wants therapy. And I said, I totally get that. I totally get that. That's hilarious. It made me laugh so hard. And I think that took her aback, because I think she said it in a sort of a salty laugh, but I don't think it was at that point, I don't think it was a entirely welcoming laugh. I'm really sensitive to the quality of people's laugh.
Yeah.
And, because we laugh nervously, we laugh kind of in a hostile way, we laugh in a lot of ways, but we had a little bit of that hostility in it. And I said, I totally get I get what you're saying. And, sometimes I call it other things, but I'm just thinking about wondering what you got to say and being here and putting it in a fun way. That's what I'm doing here for the next 5 days. So we'll get together and, if it's not for you, you can just see what your colleagues are doing here. And she goes, colleagues. And I said, friends? She said, well, fellow inmates. And I said, thank you. Thank you. You're right. You're right. That's what our stories are going to be about ultimately. And people are going to watch you tell your stories, believe it or not, that's going to happen. So we'll leave that for now, but that is what's going to happen. And, so it was a way of, it was kind of true with the refugee, with the girls who were the Center for Neglected and Neglected Teenagers in Maryvale in LA. We were doing this activity and this, I know I've told you the story, but a girl goes, this is stupid. And I said, I know. It's absolutely stupid. And so I just continued with the activity and she sort of shrugged and got into it. And, and then she made her choice.
Yeah.
And so sometimes it's that easy. She had some real tough times. But I think once you say, I'm in this, I'm going to see what it has to offer at whatever level and whatever way you do that in a group. This is the way I most often work. So, yeah.
I love that.
Yeah.
I remember a story that just came to my mind was when I moved here to Yakima, Washington, and I took over, I kind of started in a substance use disorder facility, and they provide integrated treatment for folks who are struggling with substance use disorders and mental health issues. And right away, because there's inpatient and residential treatment, I was like, drama therapy, we have to get drama therapy into this recovery treatment facility for these people, right, that are really, really struggling. And so it took me a little while, but I managed to kind of contact Michelle Bird, it was at the time, and Erin Wenzel at Antioch. And we organized an internship kind of placement experience.
Right.
Remember, we had some of your students too, drama therapy students that would come over and from Antioch, and we integrated it into their daily routine. We integrated drama therapy into their daily routine. And I can remember one of the supervisors who did not understand drama therapy, understandably, like who does until you see it for yourselves. And they were really kind of, oh, well, what's this going to do? Like very kind of challenging about it. But a couple of weeks in, I was doing my rounds as the chief clinical officer, and I was kind of going around to all the facilities, and I checked in with her, and she said, and it was Shy. Remember Shy at the time? Or yeah, she's just so wonderful. It was one of her groups that really had changed this individual's mind, and they said, we just this thing and this chanting and this. Like everybody was having so much fun, and everybody kind of that's working that kind of, is drawn towards this upbeat energy. And then Shy must have was taking them through some sort of exercise. And after the group had closed, she'd had a conversation with the supervisor, and the supervisor said, like, there's a big energy shift with these it was a cis female group. And, she was like, yes, it brings people out of their mind and puts them into their body so that they can feel more grounded and they can feel more themselves when they haven't, because of their traumatic experiences. But I really remember that, because to me it was profound. Those are the differences. When you see it, those are the differences that you can make with drama therapy.
That, and that's really true. And things have become more visible in drama therapy. So you don't have as many people saying, "What's that?"
Yeah.
And people saying, "Oh, I know my uncle was in the military and he had, yeah, my sister is a cancer survivor and she's in a cancer survivor group and they do this, or a grief group, or, all the different kinds of ways that people experience drama therapy." And then they tell somebody, and so it's not quite so anonymous. It was really a tough go at first. It was like this woo-woo thing, People, I hate that term. Not as much as I hate artsy fartsy, but
It's so, like, I don't know, it sounds punitive, right? Like,
oh yeah. Oh yeah. So I think that one of the things that I believe is true, and I kind of reinforced this when I was working with the facility in Fort Collins, with a woman who came to be a real ally in that drama group at the prison. But you don't ignore it. You don't say, and I found that so useful with drug court. What is your drug of choice? When somebody new would come, this is what we're here for, and then let that go for a while, but let that be understood. And so I felt like, here's what we're here to do.
yeah,
And it may seem like, what, I'm never going to do that, but I'm telling you, this is what we're here to do. And there are some of you who are like, I'd like to give that a try, I think. And you're going to find that that's going to expand in you.
Yeah.
So we're going to tell those stories, and you're going to cry, and people are going to comfort you, and it's going to be different in this group after you have shown that courage.
Yeah, and it's extremely individualized, right? Every individual gets maybe something different, but I think that balancing the therapeutic aspect of drama therapy with the need to respect individuals' boundaries, what they need, the pacing, like everybody's a little different, right? When it comes to performing and kind of being and processing in this way.
I remember one time, and this was just in light of what you're talking about, that the person who was supposed to say the next thing really froze up, and it is like a very difficult thing. So I don't want to say that because I come in and it's not like that. There's some tough times for people, and not everybody stays, but mostly they do. And so anyway, the person was having a difficult time, and I just held my hands, not to her face, but so it was like, please no, kind of thing. And I said, just come as you are. And I don't know, that just came to me to say that. And she goes, okay, I could do that. Remember that moment, and it was just was so special to find just that little way to give permission, because a lot of trauma has to do with being beaten down and not given the kind of acknowledgement that you should have when you're coming up in your life, when you're growing up, a lot of people have to do without that.
Yeah, and really this approach is a way to be seen, heard, valued in more of a body-based way. But there's also one of the things that I wanted to touch on actually is the cultural sensitivity, right? Because that is vital for any approach, and how I think like cultural background, right? We talk about this in supervision all of the time, like a cultural background influences a person's experience. So in drama therapy, how do you make the session culturally inclusive? What are some things that we can do?
Well, the first thing I want to do is just tell a brief story. This is one of the reasons that I chose this. And this guy is a dragon, and I wanted to use the dragon as a metaphor for, and I was in China.
Yeah,
this is very important. I was in China, and I wanted to use the dragon as a metaphor for a characteristic. What happens with a dragon? I'm asking the students, what happens with dragons, and they don't know what I mean. And I said, well, sometimes the fire must be destructive, I would think. And they're like, and I thought, okay, this isn't going to go where I wanted it to go. So I said, well, the dragon is a huge symbol in China. How did I miss that? It is reverenced. It is, it's in everywhere you go. There are these dragons that are grand. And that was my mistake. That was all. And so don't make those mistakes when it can be avoided. What are some very important cultural values? And I redeemed myself with a story that I chose that was, because it had dragons and they were all very positively represented. And so, and I apologized to them. I said that was a cultural difference, and I had it, and they were okay, so it was all right. But
it worked out well, but also you were able to repair. There could have potentially been, like, if we use attachment terms, there could have been a rupture there, but you were able to apologize, repair, and kind of move on at that point, right?
Well, in Thailand, I was taught at a refugee processing center for a while in the early 90s. And so we had Hmong refugees and Cambodian refugees and Lao refugees, and mostly not Vietnamese, but it was like people who had passed the test to be refugees. And they were, we did a story with the children that were the children of the people that I was mostly working with the teachers, but I just wanted to do this. So there were children, and the people brought their kids, and it was really fun. Well, when it came time to do the show, a lot of the kids were sitting on the floor, and I walked past, and my foot raised as high as the child's head. I mean, I didn't, which is real no. You don't do that to anybody, but to a child, it's like, what's the matter with you? You don't show the bottom of your foot. Yeah. And that for some people was not able to be repaired. So for some people, how do you not know that? Or it's a big thing. So that was actually pretty early for me in my drama therapy career, and so I forgive myself for it. But I wish I had paid more attention to all the things you need to know.
I get that. We all make mistakes, right? And we learn from them as we go on. And I truly believe the mistakes that I've made in the work that's done therapeutically is, not that it's harmed individuals, but I learn from that, and then I'm a better supervisor.
Right. Oh, right. And I definitely think that we have a lot of different cultural components to gender now.
Yes.
And so being sensitive to where people are on that, and I had a very difficult time at first with pronouns. And so I would ask people, I would say, please understand, I want you to be correctly gendered. I want to say what it is you want me to say. And sometimes I might forget because my paradigm is locked into a different kind of reality, and I'm making a change. And they would be so sweet and patient. It was wonderful. It was a wonderful way for me to enter into that new vocabulary. And so, but I think that is one of the things is that cultural humility has become a real term for inclusivity and all of the things that are a part of this the study. But so cultural humility and curiosity. So to find out, you find out with culture, there are, when I was working with Hmong refugees, they don't touch easily, and one of the ways that English as a second language, as it was called then, would address this would be some of those things where you're on a 2x4 or whatever, and you have to pass the person, so you have to touch them, but you have to touch them appropriately. And it was awful for the folks that were doing it. I think it maybe had a point, but I thought, oh, this is really good. And in a prison, I saw it with male prisoners, and it was greatly successful. It was like a way that they bonded, and they were like, yeah, we got this. Okay, we got this. And it was a competition. So different population, different cultures. Yeah. Yeah. So how does this activity resonate for you? Who is the dragon? Is it a reverenced character or somebody you have to be aware of? What's the story? And so I'm working in the Southern Oregon. There was a greatly respected elder in our valley who was from the Tekelma tribe, named Agnes Pilgrim, and who died about 3 years ago. And she had been working with a woman who helped her create the story of the Tekelma tribe, which has to do with the symbol of the salmon flying from the ocean to the Crater Lake area. And so they created together a story called Upriver to Morning. Well, when it became, then Agnes died, and the book was finished. It's beautifully illustrated. It's just an incredible body of work.
Yeah.
Songs, everything. Well, there were other tribal folks who weighed in and said, there's these two characters that you represent that if you go back and you look at who they are in another historical representation of them, you'll find that you've misrepresented them. And so in order to be culturally responsive, she has changed her book. She has come back and taken care of what needed to happen. I think they just didn't know. They were looking at storytellers. They were doing all the things they thought they needed to do. And then after that, there was that repair with that community. And it took some of the elders who are really well known in our area and to come and help resolve the conflict so that she could keep sharing her story. So that's my part of it, has just been to look at the things in the story that are universal, to the gifts of the Takelma people, to this body of story that we have, and to have students perform them and some of the pieces of the story and have it be successful around a potluck dinner or something like that. So that's been my part, is to tell the story.
Yeah, tell the story. Wow. And there are so many learning points and so many things that you can apply when kind of learning or seeing drama therapy in action. So I guess my question is, have you seen clients when you've worked with them with different drama therapy modalities, but have you seen them learn how to be more empathetic? Have you seen them learn better communication skills? Have you seen them learn more self-awareness in their everyday, and how do they apply it to their everyday lives? Can you talk a little bit about that piece of teaching in the therapeutic space, and then what does it look like outside?
Well, I'm going to speak for a moment about J.L. Moreno, who, as we know, developed psychodrama. He also developed sociodrama. And sociodrama is that very activity where you take, maybe you take the issue that we would like to talk about is that a lot of the people misgender us. Mm-hmm. And we don't like it. So now we're going to have, let's say we have 6 or 7 people in this group, or 8, it could have, and you are going to pick people who have a particular identity around the issue. And somebody is going to have to play this person, and I'm going to digress for a moment to say, at one point I directed a very major community project. Anyway, the Laramie Project, and it was, about the death of Matthew Shepard, and who was a gay man, and we lived in Laramie, Wyoming. And so one of the characters in the play is a very conservative person who's a pastor. And so the person who was playing the role of that person it was a caricature. And I said, you have to remember that this person didn't think he was a fool. You have to give him the authenticity that he came with. And so his words will have the effect that they have, but you have to be the conduit of it. You can't be an interpreter that makes him a fool. And so I think that story holds true for all of the ways that we tell the story. In the sociodrama, I say, if you are representing somebody, remember that this is their truth, or if it's their confusion or whatever it is, try to present them authentically. So that is the way that empathy starts to take hold. Yeah. That we have people who aren't making a joke of it, and they aren't angry. They aren't gratuitously angry or violent in the representation of somebody. There's been quite a lot of success. Vida and I are doing a workshop on this right now, and so yeah, and she's really got a very good grasp of how these issues then resolve. Then you're yourself again, and you talk about, what did you learn about a perspective that you invented, but you saw. Right. For a moment, you saw it.
You can reflect back on that growth. And I think, no matter how you teach empathy, it's about being able to see somebody else's lived experience that might be different than yours through a different lens, right? Having empathy for somebody is being able to disagree with their lifestyle choice, disagree with their choices, but come next to them and see their life through that lens. It's such a important part of life, but sometimes we have to kind of teach it, right?
Yes, and I think that playing characters and having that aesthetic distance helps us to. Nobody said, "Hey, Bobbi, you don't see other people at all. You judge them all the time. That's terrible." You don't have to have that said, but you will see it in yourself if you are changing your view of a person that you were just no, judging.
Exactly.
So that's when I have seen folks. That's one of the ways that I've seen folks employ that kind of empathy, and the empathy that we have, it begins with our own self-acceptance.
That's true.
And that's that radical acceptance that says, okay, this is you do hold to some of the myths of life. You really do think that you're in control and that everything's permanent and that we're separate. You think those things, and you don't have you're just not realistic. And when you get involved in these stories and you start to see that there is impermanence.
Yes. Oh,
we're not in control.
we're not.
When we are connected.
And we're all connected. Yeah. Well, Bobbi Kidder, I could talk to you all day, of course, but I'm aware of time and I just love this conversation. But I really want to ask you about your personal experience. Like, what has been one of them or the most rewarding aspect of being a drama therapist for you personally across all of the decades of experience that you have?
It's usually the moment I'm in.
Mm.
There's no other way to say it that doesn't sound cheesy. I have beautiful memories of moments, and the memories almost always are something that's kindled. Someone sees themselves or someone else. Sometimes it's people who have a conflict in a relationship. And there's this Boal's image theater where you have people in here the conflict thing, and you just say, change one thing, just change one thing, and we both have a posture of anger or whatever, and maybe put your hand down, and it's like you can see it in their face. You can say, it makes me teary. You just changed one thing, and you can see that one more thing, and one more thing, that there's an intentionality that you're putting in. Not, like you said, it's not about words.
Right.
It's about how I'm expressing the other part of communication. And when I see that happen, it's like the work is working, and I'm so happy to be there as a witness.
Witness. The work is working. Yes, and you're a witness to that.
Yeah.
It's just such a wonderful thing to share. What about the future of drama therapy? Where you are now, where do you see drama therapy heading? Are there any developments in the field that are exciting to you at this point in time?
Well, I'll start with that. One of the things that I find really exciting, because in international work, although I have tremendous respect for Landy and his role theory and the roles that he created, there are some of the I was working with a Puerto Rican group, and they were like, I don't know any of these. It's not enough. So we have Adam Stevens, who's done the Black taxonomy of roles, and there are people who have looked at autistic roles that to put in, to add, so that we have to be able to see ourselves in the work. That's why it's so important to have more people of color and more international. Yeah, just to be able to see. I want to see myself. I want to be able to feel that sense of belonging, and so I think that's really exciting to me, to see that people are saying, "Well, let's do it then." This is something we can't change, and so that's exciting. I know there's a lot of technological things and a lot of really exciting approaches and so forth. But I think this one is one that really honors humanity as we grow.
Oh, I love that. Thank you so much, Bobbi, for being here today and really just sharing your knowledge, your wisdom, your expertise, specifically for the field of drama therapy. So it's been an insightful conversation, inspiring, enlightening, all of the above. And I know our listeners have gained so much from your insights. So thank you for being here, Bobbi Kidder.
And thank you for inviting me to talk about drama therapy, Leah. I really enjoyed it.
Absolutely. It is absolutely my pleasure. It is so good to see you as always. So, well, thank you, listeners, for tuning into this episode of Tea with the Experts and Dr. Leah Merle. I really hope today's conversation has given you, maybe in some ways, a deeper appreciation for the role of creativity, specifically in healing in everyday life as well as mental health. And if you're curious about exploring drama therapy, or you simply want to learn more about alternative therapeutic approaches, which there are many, then hopefully this episode has offered a wonderful introduction, a little snapshot, a little bite-sized chunk. So please subscribe to the podcast for more conversations that celebrate really the ways that we can support mental well-being. So join us next time for more insightful discussions about mental health, creativity, and the human spirit. Until then, take care of yourself and each other. This is Dr. Leah Merle signing off. And don't forget to subscribe. Bye for now.